Get started. I know some people are still coming in from the waiting room, but just wanted to keep us on time. Um, I'm Babette Henderson. I am the Senior Director of Alumni Engagement at the Feinberg School of Medicine, and I wanted to welcome you to our Moms in Medicine webinar. Before we get started, I just wanted to cover a couple of housekeeping issues. Um, if you want to ask a question of any of our presenters, we did get some questions in advance. Please utilize the Q&A chat feature below, and please use that instead of the raised hand, as Dr. Place will be posing the questions to the panelists. We encourage you to use your speaker view versus gallery view to view the meeting. That's easier to view it that way, and you all will be muted throughout the meeting. And if you have an unstable internet connection, you can increase your connectability by turning off any other applications, internet connections on your devices. I'm pleased to introduce our moderator, who's Dr. Shelley Place. She's a clinical assistant professor of pediatrics at Northwestern's Feinberg School of Medicine. Dr. Place?
Thank you so much, Babette, and it's great to be here. And thank you so much, everyone, whether you're a participant, a panelist, or tuning in with us today. We all have very busy schedules, and to take the time to nurture yourself and connect, especially 10 months into a pandemic. We talk about physical distancing, but not social distancing, because it's really important that we still connect. We have some big topics to talk about tonight that could take hours. Some of the issues that we're going to cover today include work-life balance, setting boundaries, nurturing resilience in our kids and in ourselves, considering various stages in our training and career stages, our road to parenthood, and then how do we lead our trainees and colleagues in terms of parenthood at both the practice level, the institution level. A lot of meaty topics, just an hour and a half to get through it. So we've already gotten some great questions from our registrants that we'll be addressing tonight. But then as Babette introduced, if you have questions, please use the chat function. I'm honored to have a wonderful panel of experienced moms with whom to share this discussion. And I wanted to take some time. We're going to go alphabetically so that each of the panelists can introduce themselves, share a little bit of their story and their path to parenthood before we get the conversation going. Dr. Harris, I'd love to start with you.
Thank you very much for letting me be a part of this panel. I am a 1986 Northwestern Medical School graduate, and I completed both my general surgery as well as my plastic surgery residencies at University of Virginia, where I was the second female to ever finish as a categorical general surgery resident. And needless to say, I did not know many women in surgery at that time, nor mothers in surgery. I since have gone to San Antonio, where I've been in private practice for about 30 years, and I have two children. I had them at a later age of life. I had them at 38 and 39. They're 15 months apart, and they're both at school at University of Texas in Austin. So fortunately, they're close to home. And I've tried to think of a way to explain the complex difficulties of being a woman surgeon as well as being a mother, and not only the physical demands of surgery. I remember being 9 months pregnant and having an enormous belly, trying to maneuver my way up to the operating table, and I'd have to turn my belly just to, be able to operate. And of course, by the end of the day, my ankles were not exactly the way they normally look. And as I was trying to put all these thoughts together, I actually happened to see a Chris Rock video, stand-up routine, and I apologize to Chris Rock because I'm going to take his words out of context, but they're very applicable for the point I'm trying to make. He said, some jobs just can't have bad apples. Some jobs, everybody has to be good, like pilots. American Airlines can't be like, well, our pilots mostly like to land. And the point that I wanted to say with this is, we have to take our A game to surgery, to medicine, to our laboratory every time we go to work. And it doesn't matter what's happening in our personal lives. It doesn't matter if our child has a high fever, we're going through a divorce, we're grieving for a loved one. We have to separate the two, and we have to give 100% to both our patients as well as our families. And in the meantime, emotionally, it makes us have a lot of stress, and it's hard to take care of ourselves as well. So one of the points that I want to make is the availability of mentors. Again, as I said before, there weren't women that I could talk to when I was going through those early stages. And I think it's very important for women to identify this, that there's always somebody you could talk to. And Babette Henderson in the Alumni Center, she has some great mentors that you can also visit with. Find out how somebody else learned by experience, and hopefully take care of ourselves, take care of our family, and somehow achieve that balance that we have in our life of both loving our work and loving our family. Thank you.
Thank you so much, Dr. Harris. Dr. Humes, we'd love to hear from you.
All right. Thank you also for including me on the panel. Can you hear me okay?
Yes.
I was a 1990 graduate from Feinberg School of Medicine. I actually met my spouse at Northwestern as well. He graduated a year ahead of me. And so I've sort of gone through this whole process with a spouse who is in the medical field as well. It definitely gives you a slightly different perspective, I think, on perhaps how the female approach went to that versus the male approach. And also gave, for me, was super helpful because he clearly understood a lot of the demands on time and what have you. So I have that perspective from a marriage standpoint. I went all the way through my training prior to having my children as well. I'm an internist. And I actually run a PA program now, but by training, I'm an internist. I have 3 children. I had them when I was 33, 34, and 38. They're now almost 19, 22, and 23. So I've got 2 in college, 1 taking a gap year prior to going to medical school. So I would say from my perspective, I think it's been an interesting career path for me. I have a slightly different career path perhaps than people who have stayed in academia. I practiced in Iowa or the Illinois-Iowa area since I completed my training. I have been in private practice. I've run a free clinic, and now I run a PA program. So I think that, you know, one thing is we do love to plan, and we were talking about this ahead of time. We love to plan. Women are a lot of us are planners, and it's how we got where we got. But, you know, I would say, you know, keep that in mind, that you don't know where your path is going to take you. And I think probably for those people in the audience who have had that happen, you know, you just don't know where that's going to happen. The other perspective I have that perhaps is a little bit different is I have one of my children, our youngest child was born with microtia, which is essentially the absence of her ear. And she's undergone 7 reconstructive surgeries. And so it's interesting and hard to be the mom and the physician at the same time. And I think people make assumptions when they're talking to you and treat you sort of differently when you really wanted to be treated like the mom and not necessarily the doctor. And so if people have questions, perhaps in a situation like that, fortunately or unfortunately, I have a lot of information in that regard. So anyway, that's my perspective. I've loved my career. I love Northwestern, as we all do, but in particular because I met my husband there. So, you know, there's that. So anyway, that's me.
Thank you so much, Dr. Humes. We have a lot in common. Dr. Jones, we'd love to hear from you.
Yes, thank you. As everyone else has said, thank you for having me. So just to tell you a little bit about myself, so I graduated from Northwestern Medical School in 2008. I then did internal medicine residency at Northwestern, and I went on to do a 2-year fellowship at UCLA for primary care sports medicine. That's where I met my now husband. He is an orthopedic surgeon and was doing a sports fellowship as well. And then moved back to Chicago, I guess about 7 years ago now, almost 8 years ago. So I practice primary care sports medicine, like in the orthopedic clinic. And I also do about 8 weeks a year of inpatient general medicine teaching service. So kind of a unique combination of sports outpatient and medicine inpatient. I also am the assistant team physician for the Chicago Cubs. So that presents some unique challenges as a mom for sure. I have a 3-year-old and a 17-month-old. And I had them at ages 36 and 38. So I think I probably have the youngest kids in this group. I mean, I just finished breastfeeding like a few months ago. So just, some of the things I feel fortunate in that I didn't have to navigate having kids while I was a resident or a fellow. I think that is a really big challenge that some of the moms here will be able to speak to. But, on the other hand, I think some of the other challenges I've come across, one is just being an older mom and feeling more tired than maybe I would have 10 years ago. But also, and being in sports medicine, sports happen on nights and weekends. I didn't really think about that before I went into this field, that it takes a lot of time, and it's time outside of my regular job. I usually go down to spring training in Arizona, and when I was still nursing my little ones, it was too hard to do. I mean, I couldn't take them with me. My husband's working, so he can't really come too. And so it's just a lot of challenges and feeling like I'm missing opportunities because I want to be with my kids. And I think I'm probably the only person in Cubs history who has actually pumped in the clubhouse. So that's my claim to fame. But yeah, so that's just a little bit about myself.
Thank you so much, Dr. Jones. Huge Cubs fan, love it. Dr. Rosenbaum, I'd love to hear from you.
Thank you. Thank you very much for having me tonight. It's my pleasure to be here as a representative of the older generation of mother docs. I'm a recently retired dermatologist, married to a just retired internist. Both of us have been at Northwestern. We have 3 children that we decided to raise in the city. And so that kind of feeds into the issue of trade-offs that we all make. So we decided to stay in the city with our kids to minimize our transportation time at the cost of sending them to private school, which in the 80s you probably had to do. I don't know that you'd have to do it now. Our first child was born when I was 32, and I was an internal medicine intern, because I had another life before medicine. And then our second child, because it took so long to conceive the first one, was born 17 months later during my residency in dermatology. And our third child was born 12 and a half years later in the relative calm of private practice. So that was really nice. I was 46 at the time. So when I completed my residency in 1984 at Northwestern, I decided I would love to establish a private practice, thinking about the flexibility that would offer me to both be the best physician I could be and the best parent I could be. So I was in a position where I could gradually grow my practice, and as my children grew, the practice grew. And so ultimately, I ended up practicing 4 full days a week, seeing patients in my office. And then over the first 25 years of my practice, I taught clinical dermatology a half day, 1 to 2 half days per month, which was a wonderful balance between family, patients, and teaching. So it turns out that we all survived, and actually we thrived. Our oldest is a chemistry professor. The next one, who's 18 months younger, is a physician you might know, Sarah Berg, who's an internist at Northwestern. So I have the perspective of being the mother of a mother doctor. Her kids are 5 and 7, and she's expecting baby number 3 in May. So we're very excited about that. But I do want to say that we could not have survived and thrived without support systems. And they're different now than they probably were when I went through parenting. But there are 4 that I think you have to consider. One, you have to think about institutional support. What are the mechanisms and protocols for not only maternity leave, but prenatal care, paternity leave, family leave? Do you get not only paid, but do you get RVUs? I mean, these are issues that are important to young people considering their families and the payment, the economic impacts of it. So that's institutional. And then there are the collegial support systems. A mentor, as you've all mentioned, having mentors is wonderful, but what's the attitude of your department towards a balanced life between being a physician and being a parent? Will you cover for your colleagues? Will your colleagues cover for you? And under the category of collegiality is also the resources that are available. My daughters made me aware of 2 Facebook groups, Physician Mothers Group, which is a national one. You probably know this better than I do. And then Physician Mommy Chicago is a local one. So there are all kinds of resources. So that's institutional, collegial, and of course, family. Your partner, how you're going to balance what you need to do, the good stuff and the not bad, great stuff, but it's definitely a balance. And your family. Grandparents now I see just as a generational comment, not only with physicians, but with people in my generation, I see being much more involved with the support of their working children, their working daughters. So talk to your parents if you haven't already about that. And then the last category, besides that, I'm sorry, our friends, family and friends, your next door neighbor. If your kid's learning to walk to school and come home, are there safe places where they can knock on a door, where they know somebody if they need someone on the way home? So it's a community thing, establishing places and people that you can trust. And the last thing is paid help. If whatever you can do to acquire the help that will free you up in the way you want to be freed up is a wonderful thing to be able to do. So don't be shy about asking for support. I'm sure we'll discuss all these things. And again, thank you. Nice talking to you.
Thank you so much, Dr. Rosenbaum.
Sure.
Dr. Simon, we'd love to hear from you too.
Okay. Well, a lot of this has been said already, but I'll just tell you about me. So I'm an OBGYN at Northwestern. I did all my training outside of Northwestern except for 2-year fellowship in family planning, in which case I finished that in 2006. So I stayed on as faculty, and at 2006, I was I had a 2-year-old and I had a new pregnancy. And so every 2 years from my first faculty appointment, because I've been through the whole academe up through tenured professor, endowed chair, every 2 years I had a child. So I have 4 children. They are now 16, 14, 12, and 10. So I don't have to deal with breastfeeding anymore. Thank goodness. That was enough. But my experiences is more from navigating not just being a clinician, but also a scientist, because the majority of my job is research. I direct the Center for Health Equity Transformation. Also, not only being a woman, but being at the intersection of not only having 4 children, which was unusual in OBGYN, but also being Latina. And so having that intersection of experience of certain things that were related to ethnic or race, and also to being female, and then having 4 children, even though I am supposed to be in one of the more friendlier specialties to women who are pregnant. But it was complicated during the climb, even here at Northwestern. So I'll just leave it at that.
And we'll have lots more questions for you. And then I just wanted to share my story. Proud Northwestern Med School alum, class of 99. I have some of our class of 99 classmates here on the call tonight, and I know some will be watching the recording later. So thanks, guys. I'm a Northwestern lifer because college, med school, and then I did my pediatrics residency training at Children's Memorial, which is now Lurie Children's of Chicago. And pediatrics, they always have a chunk of outpatient pediatrics, and then small groups with first and second years. And that's been very rewarding because med school at Feinberg has changed so much in the years since we went. Every 4 or 5 years, there's major overhauls to the curriculum. This afternoon, I led a second year class of ethics, and it's so much different than when we went to med school. And I feel like, I mean, you could go to med school forever, right? Because everything keeps changing. So it's been a wonderful way to be a part of the Northwestern community. In terms of my path to parenthood, third year of my residency, they have you plan the spring second year. And I remember looking at the grid and hoping to get pregnant my third year. And I chose a schedule that had all the hard things first and then an easy spring, hoping to conceive. And miraculously, it worked out. Please note that's the universe laughing at me, thinking that things would go the way you plan it. So I did a lot of my job interviews, pregnant and with a newborn. I actually went the hospitalist route initially. I did 24-hour shifts, feeling like 6-7 shifts a month would free me up for parenthood. Very quickly, I did transition to private practice. But as many of us in medicine do, I figured, hey, I'm a mom, let's pop these kids out. I've noticed amongst our panel, a lot of us have kids close in age. I had twins. My twins were born when my oldest was 18 months. So I wanted kids close together in age, and I got exactly that. That's why my fourth child is born so quickly, because my work was modified at that point. At that time, I was in a practice that wasn't a very nurturing environment. I basically had a lot of pressure coming back from maternity leave. I had 3 boys under 2, and they were asking me to work more. It was a difficult situation, and for many reasons, I had to make some career changes. And this was difficult because I felt a lot of my peers from both medical school and my training landed in these practice positions that actually were their forever homes. And I felt a little bit alone in the sense that I already knew I wasn't in my forever home. And to be a young physician now with the internet, and Dr. Rosenbaum mentioned other physician moms groups, when you connect with other doctors at other institutions and nationally, you see that there's many paths and we don't all land in our forever spot right away. Trying to make a long story short, I had read all the books about twins when I was pregnant. They all said it's going to be a lot of work. I thought I could do a little bit better. At that time, there was no book written by a pediatrician mom of twins. And so I embarked on the process of getting a book published. That was a learning curve, the whole process. To sum up, the American Academy of Pediatrics published my book called Raising Twins. It's led to other parenting book opportunities, and now I'm a media spokesperson for the AAP as well. And so one of our issues we're going to talk about today is burnout. It's a lot, but it uses different parts of your brain. And I think you as an individual need to know what your interests are and what gets your juices flowing. And for me, teaching and this other aspect with the academy has really kept me fresh, being able to connect with families in multiple ways on multiple levels. And I just wanted to fast forward because my practice that I'm at now, I'm happy to say, is my forever home. My youngest of my 4, they're all teenagers, one's in college and then 3 in high school. In 2019, my youngest was diagnosed with Hodgkin lymphoma. And of the 10 million thoughts that go through your mind when your child is diagnosed with cancer, I never once worried about work. I never thought what's going to happen. You're worrying about everything, and thank goodness I knew that they would have my back. And sure enough, through the entire process, chemotherapy, and I'm happy to say she's doing well. She's 1 year cancer free at this point, thank goodness. All along my practice, my forever home has been so supportive of anything we needed. And I just would encourage, if you're in a position that you're feeling burnout, you feel like it's your gut's trying to tell you something, pay attention, because when things are going smoothly and it's hard, that's one thing. Then when life throws you curveballs, and as parents, we're all going to be thrown curveballs, it's important to be in a place that values you and works with you, and it's a collegial environment. That was a very long story. So we have gotten some great questions ahead of time, which I've kind of tried to put in the buckets and themes of things that we want to address today. Some of our buckets refer to work-life balance and preventing burnout and resilience and setting boundaries. So I thought I'd do a mix of going from our pre-prepared questions and then certainly chime in with more, but then getting the input of our panelists. One of our questions is, if burnout caused you to want to change your career, what changes did you make? And then this is a two-parter. This other section might be for a different part of our conversation. How did your medical career change throughout your kids growing up from babies to adults, which is obviously something we're going to kind of talk about with the range of kids. But in terms of burnout and making modifications,
My audio is, I lost my audio for a second.
Yes, I did too. It's okay now.
oh, okay.
Yeah, you just
Can
cut
you
out
repeat
there
your
at the end.
question, Dr. Fleiss? I think it.
Yeah. So this question was specifically about burnout. If you made modifications due to burnout, what changes did you make? How did you deal with that issue?
I mean, I'll start. I would say for me, I had practiced for quite a while full time in a private practice, and my children, pretty much, I had my kids close together. My first two are 13 months apart. And then I had a couple years break, and then I had another one. So for me, as I was sort of feeling the stress of that and perhaps a little bit of burnout, it also coincided when I felt like I needed to be available to my children in a sort of different way. And I think we can all speak to this, but as your children grow, the need to be there for them really sort of changes. And I know you hear this all the time, but I do think it's true that when they're young, there's a lot of physical need. But as they grow, there's also just a whole different sort of set of needs and things that you want to be able to attend to. So for me, I was fortunate enough that I was able to cut back on my practice hours during a time when I was feeling sort of pulled in a lot of different directions. So that worked out nicely for me. And I was able to do that. I had a really flexible practice that was very amenable to that, and a spouse who also was very supportive of that. And then as my children have transitioned through high school and into college now, I've sort of re-upped my hours in a slightly different direction. So like I said before, I was faculty. I'm now the program director in the physician assistant program in our area. So I think it sort of tied together and was largely driven for me, less by burnout, but more by feeling really pulled in different directions. So it's a little bit of a variation on the theme, but maybe that'll get us started.
Right, right. Thank you for that. And that was actually another question that we got in the balance of your roles, both as and there were times that you had to miss out on something from one. Looking back, what parts of parenting were the most important and non-negotiable, can't miss moments and events and activities, which kind of Dr. Humes kind of echoes to kind of segue from what you were saying. Because I think there's an expression, when your kids are small, pay attention to everything, because as they grow, they'll continue to tell you the big stuff as they get bigger. I'm kind of botching this saying. To your kids, it's always been the big stuff. And I think that making them most of your small moments together is important. There's going to be, in preparing my notes for tonight, I was remembering when my oldest was in second grade, they had a poetry slam event in their second grade classroom. I think it was on a Tuesday at 1 p.m. and an email went out or a letter came home Friday saying, we'll see you Tuesday at 1 p.m. And I thought, who can make an event in the middle of the day on a weekday with less than a week's notice? And I had such guilt. And we didn't have family in town to do that. And so, but I think that your kids are more resilient than we realize. And then when you are able to make it to certain events, they know how special that is, and they know that you jump through hoops to make it happen. And that's what really matters. And I do love the built-in life lessons of resilience that our kids absolutely learn.
Yeah, this is Melissa. I would agree with that. You can't let that get you down. Like, I remember, I've come into, was it kindergarten? For my third child, I think it was kindergarten. I went in, like, I felt so proud of myself. I was able to make it to her birthday in person, helped make the Rice Krispie nut-free, whatever, everything free, Rice Krispie treats. I was so proud. And I sat down on the chair, and I was with my daughter and all her friends. And all of a sudden, one of the kids, a couple of the girls came up to me, Natalia's mommy, why can't Natalia ever go to birthday parties? And so the kids were shaming me because of my third. I just got so swamped. I could not get to every pump it up room, birthday party, or whatever all over the city. It was just too much. So at one point, and during when my third child was in kindergarten, I had to pause on birthday parties because it was way too much. So you can't be shamed. I've been shamed by kids now. And you get past it. You start to realize how to maneuver some of these things, but you can't be at everything. It is impossible.
One of the things that I did by being in solo practice, I decided that I had to start taking a day off each week. And so now I take Fridays off. And once you take Fridays off, you don't ever go back. It was nice. I became, I'd go into my child's school, and I'd be a teacher assistant, and I'd help kids learn to read, and so I was doing something so completely different than my day job. And it was rewarding. I got to see them in the school situation that they were in. I got to know all the kids that they were playing with. And so being able to manipulate your schedule if you can. A lot of people, obviously, in group situations, you can't do that because it wouldn't be fair to some of the others. But being in solo practice, I was able to do it, and I don't regret it for a minute.
I think that
I'd like to second what Dr. Harris just said. Early on with my children so young and starting a private practice, I too always carved out Friday. And actually over 28 years at the same school, because my kids were so far apart, even the teachers who my children had sequentially understood that Friday was a day that I could volunteer. And that was such a wonderful thing for our kids and for me as a parent to be able to do. I used to worry about the economic fallout of taking that one day off, but there's no way I would have traded that time for anything.
The other thing I would say, as your kids get older, I mean, it's so hard. And I think we've all been in situations where, we wish we could have come to an event in the grade school or in the middle school or whatever. But when your children get older, male or female, but particularly my daughters, I think really, I think they look towards me or whoever, you as that physician role model, and see somebody who's really been accomplished and done some things, and they have a little bit different perspective. And I think that the little things that you miss along the way, even though they are heart-wrenching when they happen, the ultimate end game is they really come out with an appreciation, and it's hard to keep that end game in mind when you're in the trenches. I get that, but it really is true. Like I feel like they look back and they've said that, you know, my husband's a radiologist, and I'm literally, I think, the only spouse who works. And my kids are proud of that. You know, they're like, hey, look at my mom. Like, you know, she's whatever, you know, she's not that being, you know, that she's balanced that, she's figured it out. And so when you're missing those little things, just keep the end game in mind, I guess is what I would say. It's really hard to do. And I think we've all had those nights where we, you know, can't fall asleep because we feel guilty about, I don't know, 800 different things. Maybe that's minimizing it. But I just keep that end game in mind. I think that it really, in the long run, what you're doing for your children is more than just that moment, but there's a bigger game in there.
And I'll just add that, you know, my kids are a little bit too young to have any major events to go to or to miss, for that matter. Although my kids are at the daycare that's affiliated with Northwestern. So, you know, all the parents work at Northwestern, and they have this like Halloween parade that's in the middle of the day. And I'm always thinking, like, who is able to go to this? Their kids are in daycare. Whose parents are able to go to this? But I think, you know, because my kids are so young, they go to bed early. You know, the little one goes to bed at 6:30, and the next one goes to bed at 7. And so that's not very much time after the workday to spend with them. And so I was sort of accustomed before having kids to work as late as I wanted to or needed to get my work done. And I think what's really helped me is just setting a boundary on how late I can be at work. And, you know, I only have so much control over when my last patient is, but I do have control over when I stop writing notes, when I stop making phone calls. And so I think that's something that's been really helpful to me, is just, I'm leaving the office at this time because I want to have an hour and a half, you know, with my kids before they go to bed. And just, I think everyone now sort of in my office who kind of works around me, they just know that. So they kind of expect, okay, you're headed out soon, huh? So I think that's just something that's been really helpful for me to really protect some of that evening time with the kids.
And normalizing that behavior and helping foster that culture that's what parents do, whether you're a mom or a dad. And that some of what we brought up kind of segued. We're getting some great questions in the chat, so thank you, everybody. I got an anonymous question that asked about partnership roles and how do you balance parenting within the partnership, especially if your partner is also a physician. I know that's one of the themes we wanted to get to, involving and delegating to your support networks, whether that's partner, family, work colleagues, your neighborhood, hired help, but specifically for partnership, and specifically if your partner is also a physician. Can anyone speak to that?
I think that I had a difficult time doing that delegation. I grew up in a very traditional home, and my mom never worked. And so making the transition to having both parents work and taking care of the kids, that was always something very difficult for me to process. I still think that, even though my husband's a urologist, I'm a plastic surgeon, we both have busy surgical specialties, and I'm still the one who came home earlier. I'm the one who read the books every night before going to bed. And I think that I should have, you know, done better with delegating, but it's hard. You want to be mommy. You want to do, you know, give 100% to your kids. And sometimes if, you know, since my call schedule was easier, it just, a lot just fell on my lap instead of my husband's.
I think sometimes those roles can evolve naturally. My husband is an internist. In the days when there were no hospitalists, would get up very early to make hospital rounds. And so I would be on with the children in the morning and getting them up in the morning and giving them breakfast and hopefully giving them a positive start to the day and bringing them to school. And because I was in private practice, I was able to start my day at 9 o'clock, which sounds so late because the kids were in school by 8:30. My husband would get home earlier and I would finish up at the office. So he was in charge of what we used to call International Grumpy Baby Time, which is at about 5 o'clock when the kids are tired and hungry. So he would get that role. And then I would come home and do bath time and reading before bed. And then in those days, you had to bring charts home. It wasn't working on a computer like it is now. So then once they were tucked in, we do work, but it requires conversation and recognition of each other's limitations, either endogenous or exogenous limitations. It's not easy.
I would say that I too am sort of guilty of what Dr. Harris was guilty of, and that is you want to be all things. And I was not very good at delegating or splitting responsibilities early on. We started, when I went into practice, there was no hospitalists either. And so I took a job in which there was no call because my husband was going to be on call. And we just were, that was a decision that we made jointly. But I do think that it's really easy to fall in the trap of, oh, I need to do that because I'm the mom. I need to do that because I'm the mom. And I would echo also what Dr. Rosenbaum said. If you have the ability to pay somebody to help you with things that aren't critical to the relationship with your child, do it. Free yourself up that way. And it, like I said, there's 800 things to feel guilty about. Don't feel guilty about that one. It frees you up. I did get better over time. And when my kids were in high school, we had a rule, and it was, you get a parent at an event, like one. If you're lucky, you get two, if it's a big event. But I did get better at sort of letting go. I feel really hard. And I don't know that I was great at it, to be honest.
And regarding the balance of partnership amongst especially dual physician parents, which is my situation as well, realize that it's not always each other, it's society, because many school teachers will default email the mom. There's an issue with the kid or an issue they want to bring up, they'll email you. Just last month, my daughter's dad took her to the orthodontist. He was off work. They left the office. They called me. I was seeing patients in the office and they called. I don't know why I answered the phone. I think I was like thinking there was an emergency at the orthodontist. I don't know. And they said, they just left the office and we wanted to book your next appointment. And I thought, well, they're capable of doing that or calling later. But again, sometimes it's society and the structures that default setting put us females in charge of everything. And so to exhibit grace to your partner, because sometimes it's not their fault.
When we started having babies in 1980, I had never seen, in our neighborhood, I hadn't seen a father with a stroller before, except my husband. And it was just, it's so different now. It's just a whole new world. But he was always a good mama as well.
So we're getting other great questions, kind of on the theme of burnout, making time for yourself and your partner with all of your responsibilities. Advice for that?
I think that it's very easy to get consumed by life's activities, and to have something where you can unwind. I started playing the guitar 3 years ago, taking lessons once a week, and it's been one of the most rewarding things. I have an art background, trying to paint, doing something where, we're all type A. So I think in general, we'd like to be productive while we do that. So I'm learning to play songs and I'm painting paintings. So I'm getting things done as well as enjoying myself. But you have to encourage yourself to do that, and, give yourself just a little bit of me time. as often as you can, which is easier to do as the kids get bigger.
I think it's important too, as the kids hit middle school and high school particularly, that they see their parents enjoying not only their professional life, but of course parenthood, but something else they love. Like for you, it's painting. For me, I started to row when my kids were in high school. And it's just been such a wonderful, totally wonderful balance between the control we all think we have to have during the day as physicians, the fact that we are responsible for delegating to other people. In rowing, someone else is telling you what to do. It's actually quite a nice break. But it was also wonderful for our kids to see that. Our kids have each developed their interests in physical activity or other or arts and other things, but I think partly because they see their parents doing that too. It was very hard to find the time, and I could rationalize it. It was not only for me, but it was for my kids that I found that time.
And you get creative too. I started running after my fourth was born. And there were times as my kids got older where they're like, oh, where are you going? And I remember I would even say, well, I want to meet my grandchildren one day. And I would make some silly joke about like, I'm being healthy. And Dr. Rosenbaum, I couldn't agree more. Like they need to see that we are full people. I guess I would add too, especially in the era of COVID, and we're all very aware of mindfulness and self-care and taking breaks. We're all unique, and what works for some of us won't work for others. Especially like I'm thinking of group classes when we're allowed to go to gyms, which we're technically not allowed yet. But for me, going out in nature and having solitude is my recharging. I feel like I have a job that I talk to people all the time. And so to have that refresher and being outdoors, even if it's January in Chicago, is rejuvenative. For others, it'll be a more social situation. And so just know that we're all unique in that way.
The other thing I would say is, I mean, I agree with everything everybody else said, but I also think it's really critical to, and again, you know, you learn a lot as you go along, and I don't think I was very good at this when our kids were little, but you need to spend time with your partner that's unrelated to your children. And I remember thinking that we went out to dinner, our kids were probably still quite, you know, in the elementary building with friends. And I remember looking over at my husband and thinking, oh, that's why I love you. You know, like, I got it again, you know, because you're just, and I used the term before, you're so in the trenches. It just seems like, oh my goodness, I couldn't possibly do that. Like, I'd rather go to sleep or, you know, do anything than, and I really feel like, again, it's a great role model. And my youngest, who's now a freshman in college and who's been home, she's like, wow, you know, you and dad need to get out. And I'm like, we do, but it's COVID, you know, and they need to see that piece as well. And you need to nurture that piece. I know we hear that a lot, like you should have a date night, but it is kind of true. And I think an important thing to remember, especially when your kids are little, it's harder, I think, to do that.
Speaking of one-on-one time with your partner, being a mom of 4, one of our challenges is one-on-one time with each child. And when one of my twins was 4, he needed stitches, and it was New Year's Day. And so it was him and mom and dad. And I was watching him get sewn up and thought, this is really, when does he ever get his mom and dad alone to himself? And how sad that it's stitches or surgery that gets you your mom and your dad alone. So starting then, we started a new tradition of when it's each child's birthday, they get mom and dad alone at a restaurant. This looks different in COVID because Illinois restaurants are closed right now, but I thought it was so pathetic that the only time my child got mom and dad to themselves was because of stitches. So we figured birthdays, we can make it happen once a year. And that includes my twins. They get a separate outing with their parents. So that was one way we kind of built it into our schedule to make sure we didn't miss it because it goes fast.
One point I'd like to make from what you just said, when my kids got to be about 10 and 11 and were old enough to really, want to get to know us better, my husband and myself, my husband recommended taking each of them for a long weekends trip where it was just one-on-one. So when the girls turned 10, I took them both, 1 year to New York City, the second one, the next year to New York City, because that's one of my favorite stomping grounds. He took the eldest to Yellowstone 1 year, and then he went to the Acadia National Park with the other one. But it was a time where they spent with just one of us, and it was, nobody else to fight with or compete with. And that, asking them now, that was one of the best experiences that they ever had when, with their parents. They bring that up all the time.
To add to that, when your children may be going to overnight camp in the summer, our kids went to 4-week sessions, and my husband and I decided, as many of you have said, that our children needed one-on-one attention. Because my kids were teenagers when we had the little one didn't figure into that so much. But we decided to send one child to camp and have one of the teenagers home. And then they switched so that the teenagers got the undivided attention for 4 weeks, and then it was switched. And friends of ours would say, oh, why didn't you send them both? Why? Because we wanted to give each kid their own time and do special things with that one child at a time. So that's, relevant all the way through whatever developmental stage the kids are.
So we've got a lot of great questions coming through on the chat. I'd like to shift gears a little bit more towards training and institutions. One of our questions was, could we comment on the opportunity to negotiate longer term or fewer hour residencies to accommodate childbirth and child rearing? And this was a very specific question about commenting on residencies providing fertility preservation options. I guess just big picture wise, timing and training, and what does that mean, and how did you inform leadership, and what did that mean?
I mean, this is Melissa. In OBGYN, the residency is pretty baked, prescribed, and it's a lot of our residents have taken maternity leave, but it is a very specific time, and there's a certain number of weeks you have to be a resident for to complete your 4-year training. So there's a little less flexibility, but in OBGYN, absolutely, you can have a child or two. But in terms of extending it or putting it on pause, it's a little more challenging, I would say, from an OBGYN perspective.
Yeah, and I think a lot of us had children after training. I was still a 3rd-year resident, and this was in 2002, so things keep evolving. But I had chosen a schedule that we were all involved in a senior research project. And so that was my maternity leave. And then when I returned, it was emergency room shifts. So during pregnancy, I swapped overnight calls with my colleagues to swap for ER shifts, just to kind of extend it. I did end up working a fair number of shifts, but then it wasn't like coming back from your first kid, full resident schedule. That really helped a lot. And my colleagues were wonderful and very willing to pitch in, and it was win-win because a lot of people needed call coverage, so it worked out. So creativity, I think, is key. And I'm sure that things have evolved since then because this is 18 years ago. in terms of institution and colleagues, we kind of touched upon this, evenings and weekends. Dr. Jones, you'd mentioned this. How do you balance that? I'll speak for myself, choosing the hospitalist option with 24-hour shifts. And then I actually preferred to work weekends because then it alternated when my kid's dad and I needed coverage. So kind of working opposite schedules from each other was actually helpful when our kids were young. But I'll let you guys chime in with that as well.
Melissa, so yeah, I prefer to take overnight shifts. So one thing, the one I would say advantage of being like a physician and a scientist type academic, I can have flexibility with my clinical time. I can take like overnight shifts on the labor floor. Those are kind of like hospitalist or ER shifts, but I can also then write and do like that scholarly stuff at very odd times of the day and night and weekends. And when my children were younger and taking naps, that's when I would take advantage of that. Like when they were sleeping, that was great. And when they used to go to bed early, that was great too. But now when they're like 10 and up, they don't go to bed, and that is a problem. And that's usually when you're needed most, is when you come home from work after a long day or a long shift and you need to write, and there's no way, because you've got to deal with 4 kids who you know, have a lot of things they want to just tell you about or need assistance with.
So one of the questions that I wanted to ask the other panelists as well is, you know, occasionally I've come across some of the men in surgical field, especially, that, you know, resent the time off of not being able to contribute the same amount of time to the on-call schedule, feeling, you know, that it's not fair to them if a woman takes time off, and any resentment that they might have. Do any of the panelists have any experience with that, where, you know, they've had, you know, to deal with that kind of stereotype or prejudice while they worked? Because I've seen that in surgery, certainly.
I mean, I would say when I first started working, I picked a practice in which I didn't take call. As I said before, that was before hospitalists and what have you. And I got a few comments from some of almost always male physicians who were like, oh, you know, you chose to do boutique medicine or whatever. And I thought, well, you know, you could have equally chosen my job, but you didn't. And I have to say, in my husband's group, they have, I don't know, 15 radiologists, and for a long time only had one woman, and she took maternity leave, and some of the men were bent out of shape, and she told them that she would be happy to cover it for them when they had their MIs. So she sort of fixed them there. But I think that was really difficult for her. So you know, hopefully that was a long time ago. Again, that was probably 20 years ago. I don't know, you know, maybe some of the younger panelists can contribute, and hopefully that's sort of gone by the wayside. But
this is a naive question, but in fields that are not medicine, paternity leave is quite common. Is there paternity leave for male house staff? There can be for men working for an institution after training, but is there such thing as maternity leave for male residents? Has anyone heard of that?
I've never heard of that.
We did get a commenter in the group chat, and I think this went to everybody, that starting in July 2021, it is phrased as a more progressive parental leave policy. So my hope is that that includes the men as well. So thank you for that. I'll share that in my primary care pediatric setting, we have a range of ages, and one of our younger male partners recently had his second child, and with each of his children, he took a full month off, which compared to my California non-medical brother didn't sound like a lot, because my brother had a much different situation. But I loved that he is practicing what we're preaching as pediatricians, and especially in a child's first weeks of life, it's such a time for bonding for everybody. It's a lot of the groundwork is laid there.
So true.
And we talked about partnership and equal partnership. As a pediatrician, when I speak to moms and dads, I'm very intentional with my eye contact, looking at the dad. Even if I'm talking about breast milk, I'm looking at the dad. And I think it's some sort of like just, I want to lay that groundwork that you are involved. You are very much a parent. It's not just all on mom, even if we're talking about nursing, because boy, you need a lot of support when you're nursing.
Just to kind of make a comment about that, I obviously just recently had kids. So recently was on maternity leave twice, and then of course coming back, I had to, and my practice has been really great about this. I don't think anyone's ever made me feel guilty. Most of the other physicians I work with are men, but they're all surgeons too. So we're not really sharing the call burden. And so I actually don't really have like a direct colleague to cover for me when I'm gone. So most of my patients were sort of spread among a lot of the orthopedic surgeons. So none of them said to me directly that that was a challenge or frustrating or annoying for them. Most of them were very nice and gracious about it. But I think what's, another thing to comment on is that when I came back, I couldn't see the same number of patients that I was seeing before. I was pumping 3 times while I was at the office. So that's, several patients slots that are getting blocked, which was great that I was able to do that. It's for those of you, I'm sure many of you have gone through this, it's stressful. So you're worrying about the patient that's waiting for you, or you're waiting for a patient who's late, which then makes another patient suffer later on. And it wasn't really until I realized patients can wait, this is important, that I think I sort of got past that guilt of, making patients wait while I was pumping. And then, the other part of that is, and as we've mentioned before, the daycare always calls me when the kids get sick. And so I'm always the one who's leaving work, or, and so that's just, it's just something that you have to accept or deal with, that you're just less productive, or at least that's kind of how I felt. And I still feel less productive because I have all these other responsibilities. I mean, my son back in November was diagnosed with COVID, and my husband and I quarantined with both of our children for 24 days. So we basically did not work all of November. This is segueing into how COVID is affecting all of our lives. But that's, I was like, I got 25 RVUs in November. And that's just from like a little bit of telehealth that I did. And so it's just, there's just a lot to think about, even when you get back to work. We have a lot of responsibilities that are going to require that we miss work.
And Dr. Jones, that was the perfect segue, because we did want to address the elephant in the room, meaning we've been in a pandemic for almost a full year now. It's crazy to believe. I hope that it was a good November, though. Silver linings?
There were some silver linings. The weather, if you guys remember, was beautiful in November. And so when we were like kind of allowed to go outside, it was nice to be able, I was looking back at pictures and the kids are wearing shorts. So that was a silver lining. And, certainly that was something that I tried to remember through it all is, is that this is time that I would never otherwise get, you know, when my kids are so young. But yeah, as you can all imagine, it's a challenge when the kids, they're at ages where they need us all the time. So there's just not much of a break.
And I think for a lot of families with school age kids, the pandemic has been a wake up call because a lot of suburban families are go, 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 schedule, multiple sports, musical instruments. And it's been a time for everyone to slow down and prioritize and see what's really important. So I'm hoping that some of those lessons carry over even when society reopens. Dr. Humes, you look like you're going to say something.
No, I just, you know, it's been a long 9 months. It's been a long 9 months. I think we probably all feel like that. And you learn a lot about yourself and a lot about your patients during, not your patients, but your personal patients during that time span. I just, and it's true, there's a lot of good that came out of it too. You know, there's a lot of moments that were wonderful, but I'm personally looking forward to that day when we can all go back to, you know, just sort of going about our lives in a more general way. But I didn't have kids my kids were impacted by COVID only in a college sense, which is very different, I think, than those of you who have children who you have to negotiate hybrid learning or remote learning in either the elementary or middle school or high school buildings. I think, I don't know. I can't really speak to that part of it because that wasn't it. I was just, you know, reliving the COVID year in my head. So.
My daughter was in Spain and she was studying abroad that semester, and she was told that she had to get out of Spain immediately or she wasn't going to be accepted back into the university. And she had to try to find a way back to the States when all the airlines were shutting down their flights. So talk about a nerve-wracking, she had about a 3-day journey of something that should have taken 1 day, of course. And when she got back, I was obviously very happy, but she missed out on half of her study abroad. But it also is going to give her some good stories to tell someday, I guess.
I think it's also important to note that for the researchers, they're also during the pandemic, there is options to pause tenure clock. In addition to non-pandemic times, there's options to pause the tenure clock as you climb the academe for like child issues, parental leave, FMLA. You can pause it, and like at Feinberg, you can take 9 years to get from assistant to associate with tenure instead of 7 if you need to. So that's also helpful too, is that you can extend the time because you're in the Feinberg School of Medicine. So that's a little different than the other units across the university with respect to tenure. So there are some good leave policies in place for faculty. But also with COVID, I think what's really important is understanding that there's immediate impact and then there's longer term impact. And I think a lot of women faculty and physicians with or without children, but with children because of this panel that we're focused on, we've run like a marathon every single day, and we've done it for a very extended period of time, for almost a year now. And what I worry most about is what's going to happen next year. Many of us have just tried to keep going. And then all of a sudden, I feel like what we really need to look at, because if you look at NIH funding, if you look at some other indicators, it could be RVUs, whatever, there hasn't been too much of a change yet, but they're male versus female. But if you start to look later on, how is this going to, roll out? And so I think for those of us who are looking at that, or who have programs, or who are looking to build programs to support women in medicine, I think it's what's going to happen later this year and then the next year coming up. And then what that may also very well impact career choices too, not only for those of us in a career faculty level, but also like how residents choose either to go on to a fellowship over the next few years, or how fellows choose whether to go into academic or to private practice, things like that.
And obviously today's focus is in terms of supporting our children, but we're also of the sandwich generation where a lot of us are in a position where we're caring for our parents as well. And speaking of society expecting female, like we're the givers, we take care of everybody. And so and I agree with you, Dr. Simon, I'm concerned about what the future will bring. So we're getting more great questions. One was very specific. If any of us grew up as a child of a physician, and how did that influence us and inform our own parenting? I thought that was a great question.
My father was a house call making doctor on the north side of Chicago, son of Italian immigrants. So he would go from house to house and get fed by patients that he was making house calls with. And he took me, and he sometimes would let me carry his black bag. But it's interesting that even though I did that, I was the one who was always intrigued by his books, looking in his books, and wanted to learn about what he was doing. I even worked as a nurse's aide in his hospital when he was at Ravenswood. I'm the only one who, he really didn't even push to go into it. He wanted my brothers to go into medicine because he was a traditional Sicilian man, and yet I'm the one who chose to go into it. It's kind of one of those ironies of life, I guess, but it definitely, I have wonderful memories of working with him, and I think about him as his dedication towards his practice.
My dad is a retired OBGYN, and so of course he was my hero, and it never occurred to me as a little girl that it might be hard to be a doctor and a woman at the same time. And I kind of laugh at young, naive me at how much I didn't know at that time. But in a way, I'm almost glad I didn't know. And I think a good analogy, there was another question about timing of parenthood, and this individual wrote their question that there's no good time to have, hold on, I have middle-aged eyeballs, I can't find it. Okay, I've often heard statements along the lines of, it's never a good time to have a baby, you just have to do it and then you figure it out. Do you agree? How do you approach family planning during your training and career stages? And ladies, I'd love to hear your thoughts.
Well, I think it was mentioned that people plan and God laughs, or something like that. I was planning to get pregnant exactly during one of my clinical rotations, my senior year of medical school. The bottom line is my body did not cooperate, and I got pregnant when I got pregnant. And so life happens, whether it's pregnancy or other things, and you just do your best to accommodate. It's ideal. It sounds like you were able to plan around your medical training schedule, which is wonderful. And if you can do that, you're fabulous, but not all of us can do that. So I also started medical school when I was 28, because I previously had, I was an anthropology major at Washington University and studied medical anthropology. And then I got a master's at Northwestern in medical communication. And I was a medical writer. I did patient education writing. But I had also done pre-med at Washington U because I love the sciences. So the bottom line is I started medical school at age 28. and did not want to wait till I was done with my training to start to have a family. So you just deal with it.
I think that a lot of us, just from the beginning, did wait till the end of our training or after our training to have our children. But I also think that back in the day that it was less common to start later and be a non-traditional student, or even, I mean, a gap year really wasn't, when I went through medical school, a gap year was not a thing. It was an unusual thing. And now I think it's really fairly standard for at least a year or two. And, I think that the research component that was a part of residency programs was definitely less intense or intensive. And so people got through in sort of a faster way. So that, I went straight from college to medical school to my residency and was done. And so it made a little bit more sense. I don't know if that's the case anymore. And in addition, when I was a resident, we had to walk uphill both ways in the snow. And I don't mean by any means that it's easy to be a resident at any point in your life, but at least there's some parameters in place that really weren't in place when we were residents. And I think that goes doubly for somebody who, was a surgical resident, that there just weren't any parameters in place. So I think just the mere physicality of it was really different during that time span. So maybe somebody who's younger can sort of speak to, is it easier to have a baby when you're a resident? I know one of my fellow interns had a baby when she was an intern, and she slept more at the hospital than she did at home. So I don't know what that says, but you can plan all you want, but sometimes it doesn't happen. I don't know. Now it might be a little bit easier to do it during that time span, or because of the length of training.
There's definitely more protections in place, but it's still hard, and there's never a good time. Spoken from an OBGYN, there's never a good time. You just make it work. That's what we do, right? And it's just going to be different for each different circumstance and each different stage of your career. I mean, I've taken kids with me to research meetings and breastfed them during the research meeting. It's just, this is what it is. People are a little more accepting of being flexible. And I think actually this pandemic hopefully has instilled some flexibility in meetings. I think these crazy surgeon type schedules where meetings have to be at 7 a.m. before the OR block time starts, or, at 6:30 a.m. or at, 6 p.m. Those are like key moments in a family's life where you're trying to get your kids to school or get them set up for Zoom school, whatever it is, trying to get dinner on the table at around 6, 7 p.m., trying to get them in bedtime, and you're still doing meetings. So this whole pandemic, I think, has helped. Hopefully people will remember in a year or two that we can be more flexible with when meetings are done, and be more flexible with Zoom meetings and call meetings as opposed to required in person.
I'm getting a question that's a little bit more, it's funny because as you were talking, I'm thinking about how much of parenthood is in the details. And just when I sat for the board exam for pediatrics in 2002, when I was a little girl planning to be a doctor, I didn't think in the year 2002 I'd have to wonder where to pump. But it was a big thing to figure out where to pump during a day-long board exam. One of the questions we got was how many of us are full-time and how many are part-time? And I can lead us off with that one, because I feel like there's seasons to parenthood, and you won't be all things to all people at all times. And there's going to be times where you're leaning more into one zone and leaning more into another. I'm very much full-time right now, but when my kids were small, I was part-time in terms of my clinical responsibilities. But then that's when I was working on my twins book, which was perfect because Dr. Simon talked about writing during naps. Naps are precious. I also remember bringing my kids to the neighborhood park, and there are parts of the books that I remember who was doing what when I wrote those sections. So utilizing that time for other projects, which I think is a fun part about having different elements of your career. But there's going to be seasons to this. And I think it's challenging. There was another question specifically about how do you juggle your early career with the needs of young kids. But in my experience, it didn't all make sense at the time, but then it made sense as time went on. But ladies, would you be able to comment on part-time, full-time juggling as through your kids' ages?
I powered through. I'm full-time throttle. But you know, that's kind of, it's a little sadistic. So, you know, take time when you need to take the extra, if they give you extra time for tenure, or they give you opportunity for true part-time, like you have to be careful with that part-time stuff, because part-time clinical or part-time anything is never part-time. If you like have 3 half-day clinics, I mean, come on now. We all know that a half day rolls over to the full day, or at least part of it, and there's always all the follow-up. So, you know, you have to be really good at negotiating and structuring your schedule. And the leaders have to be really good at understanding what that really means. And so that's why we need more women leaders, but that's a whole nother talk. I'll let other people speak. I'm going to storm the gates if anyone wants to help me. But the other thing is one of the policies we had to change at NM, Northwestern Medicine, was the RVUs. Like that recently changed. I was one of those people who brought it forward, because when you took time off or maternity leave, your RVU denominator didn't change for the year, and that's BS. So you have to, so we got that time taken out of the denominator when you're on leave. So that's a big thing, because women were being penalized for taking maternity leave with their RVUs.
Thank you for that. That affected me. Yeah, because I remember too, it was like you were penalized more. I had my first child on September 3rd, so the very beginning of the fiscal year. So I feel like for whatever reason, it was even worse to have a baby in that first quarter than to do it in the fourth quarter. You were like more penalized, but anyway, so thanks.
That was also an issue for our daughter, who had her first 2 children when there was no RVU payment. And she also went to bat and said, you need to pay for RVUs, because essentially your RVUs were paying for your maternity leave. So finally, I think that's why she's having her 3rd baby, because she's going to get RVUs this time.
Well, working as a primarily solo plastic surgeon, if I didn't operate, you know, I wasn't making any income. And despite that, I just realized that it was more important to me to cut my hours so I could be home with the kids when they were small. When they got older and they were in school, I had the rationale that when I went to work, they were in school, and I tried to time my work schedule so that there was that good overlap, that it wasn't my hours running way past their school hours. So I was able to pick them up from school as much as I can, which best case scenario was usually about 2 or 3 times a week, but it was something.
Go ahead.
Yeah, I sort of mentioned earlier that I also sort of, as Shelley did, ebbed and flowed. I started out full time. With each, I have 3 children, so with each child I cut back. So I worked 3/4 full time when I had my son, and then 3/4 with my first daughter, and then half time. And then I actually had a period in time where I left my practice and started and ran a free clinic, which was just 2 half days a week when my 3 kids were sort of really in a very sort of physical, needy way when they were young. And I really wanted to be present for that, and then went back as my kids got older and more independent, went back and then now full-time again. So it really does, I think it can really change up. I think whichever way you personally feel works for you. I can't emphasize enough. I feel like I'm like the please don't be guilty panelist. Don't feel guilty about what works for you. For some of us, we're better parents if we work full time and we are meeting our intellectual needs. And for others of us, the opportunities present themselves or we have different needs, and that's okay. I think that's the biggest thing. I don't think a male would ever, and I'm going to really stereotype, ever worry about that. They would just never worry about that. They would do what they wanted to do. If they wanted to work full time, they'd work full time. If they wanted to stay late, we need to adopt a little bit of like, hey, this works for me or us or whatever, and not feel so like, worried about what other people are thinking about, how you should run your personal, balance. Okay, I'm done with my guilty talk.
And if your kids go to school with or are friends with a disproportionate amount of families with a stay-at-home parent, connect with your other physician colleagues, connect with your friends who are non-medical who also work full-time. I think there's so much to be said for that support and knowing that it's not just you, even if it's just to complain about a poetry slam with 3 days notice. But that networking and connection is important. Because especially depending on where you choose to raise a family, you might be faced with some of that. We unbelievably are almost to 7:30. So I want to thank our awesome panel. You guys are awesome. Thank you for sharing your experiences, your insights with us. This has been fantastic. And I hope it's a launch pad to just keep the conversation going. I want to thank the Northwestern Alumni Association for having a Women in Medicine initiative in the first place, that we can have these focused talks. Today's was on parenting, but there is so much, as Dr. Simon alluded to, there's much, much more. So we barely scratched the surface, but this was fantastic. And I hope you guys enjoyed it as much as I did. And thank you everyone for your time and participation.
Thank you so much.
Thank you. It was a pleasure.
Thank you.
Thank you.
Thanks, everyone.
Great evening, everybody.
You too.
Good evening.
Bye-bye.
Bye.